Good morning, everyone. My name is Gil Munoz, and I am the CEO at Virginia Garcia Memorial Health Center. It is my pleasure to welcome you to Virginia Garcia's annual Healthcare Symposium. It's great to see you all here today. For over 12 years, Virginia Garcia has been holding the Healthcare Symposium to bring people together across a variety of sectors, including healthcare, education, business, government, philanthropy, and social services, to engage in discussion on the key issues of the day that impact community health. Over the years, the symposium has covered a wide range of issues, from healthcare transformation and the Affordable Care Act to teledentistry and research on blue zones. Today, we reflect on our experience responding to COVID-19 and lessons learned. As we look to the future, it is important that we recognize the importance of the partnerships we have developed over the past 2 years. We must continue to work to ensure that these partnerships are not a temporary process, but become part of the permanent healthcare collaboration. If the last 2 years have proven anything, it is the power of community. There is nothing we can't do together. Thanks to these critical connections, Virginia Garcia was able to leave our clinic walls and create change in big and impactful ways. Our numbers speak for themselves. Over the past 2 years, we have hosted or co-hosted more than 500 clinic and community-based COVID-19 testing or vaccination events, resulting in more than 25,000 people being tested and more than 75,000 vaccinations being provided. Roughly 68% of those we reached were from communities of color. Virginia Garcia did not do this alone. Many of these events were done in partnership with organizations, school districts, and public health organizations. The pandemic exacerbated longstanding inequities in healthcare, particularly as it relates to communities of color. But it also led to innovations and collaboration across the community to address these disparities. I am proud that Virginia Garcia was helping lead the effort to provide the kind of care our communities need and deserve. It is important that progress like this continues. The alliances and partnerships that were formed over the past 2 years must continue moving forward. Together, we can define what healthcare will look like in the future. Now gives me great pleasure to introduce our symposium moderator, a community leader, ally, and champion. Carol Cheney, CEO of the Collins Foundation, was adopted with her twin from South Korea and grew up in Maryland and rural Oregon. She has worked as a farm worker, domestic violence advocate, health educator, nonprofit consultant and trainer, and policy and community engagement manager for the Oregon Health Authority Office of Equity and Inclusion. Prior to coming to the Collins Foundation, Carol served as a program officer, then diversity, equity, and inclusion manager at Meyer Memorial Trust, leading the organization's internal work to advance equity. She has served on the boards of Seeding Justice, the Hambleton Project, and the Oregon Coalition Against Domestic and Sexual Violence, and is currently a board member of the Pride Foundation and Foundations for a Better Oregon. Carol is driven by a passion for equity and deep inclusion and a conviction that each of us has a role in creating a just society for everyone. Take it away, Carol.
Thank you so much, Gil, and thank you very much to the Stephanie and the whole Virginia Garcia team for all of your support. I'm starting my video now. Hopefully that's working. And it's my very great pleasure to open and moderate the symposium today. In my lifetime, I don't think I've ever had a greater opportunity, that we've ever had a greater opportunity to come together as community members, organizations, institutions, and funders alike to more deeply examine the persistent presence of inequity, our long-held approaches to our work, the importance of community-based organizations as full and expert partners, and the potential power of what we can do as allies when we work together. From the very privileged vantage point that I hold in philanthropy now, I have witnessed the challenges, the creativity, and the just-in-time versatility and responsiveness of community-based organizations who just simply responded when the pandemic hit, supporting the healthcare system to deploy thousands of vaccines, especially to small, rural communities without a healthcare infrastructure, or to people who experience systemic barriers such as language access or 9-to-5 clinic hours. They were quickly able to reorganize and coordinate efforts to gather and distribute food, rental assistance, money to people experiencing job loss, and food and housing insecurity, all the while building trust in a way that when fears of vaccine or healthcare were present, really had a part to play in influencing people's decisions about whether to access a vaccine or not. Without these organizations, it's really hard for me to imagine where we would be now. But no one sector can do this alone. And luckily, in our larger institutions, we are witnessing the letting go of long-held ways of doing things to be right where we are most needed. And what an opportunity that is. Now, as we enter a new season, literally and figuratively, we have the opportunity to consider the next normal for healthcare in the post-pandemic world, the subject of today's symposium. Let us not forget that as leaders in healthcare and also consumers of that care, what we learn and do right now matters. Today, I hope you're as excited as I am to learn from our esteemed keynote speaker. Beshara Shuker, MD, is Senior Vice President and Chief Health Officer for Kaiser Permanente. Dr. Shuker, who actually prefers to go by Beshara, oversees the organization's efforts to address the social health of its 12.5 million members and the 68 million people who live in the communities it serves. This work includes the creation of the nation's largest social health network, integrated with Kaiser Permanente's community health portfolio, and is responsible for the organization's environmental stewardship work, leading to Kaiser Permanente's becoming carbon neutral. Very cool. From January through November 2021, Beshara also served as the White House National Vaccinations Coordinator. He has served on numerous boards, including Change Lab Solutions, National Healthcare for the Homeless Council, Campaign for Tobacco-Free Kids, and Futuro Health. He has been recognized as one of modern healthcare's most influential people in healthcare. He holds an MD from the American University of Beirut and a master's degree in healthcare management from the University of Texas at Dallas. Dr. Shuker, Beshara, welcome.
Thank you, Carol, so much for the wonderful introduction. And it's great to be with everyone today. I am so thrilled to be part of the symposium and be participating in this discussion. Let me just start by saying, as a family physician who trained as a community health center, as a physician who practiced at a community health center, who served as a medical director and an executive director of a community health center, it always warms my heart when I get a chance to come back and spend time with my community health center family, and it's great to be here in Oregon. And I'm particularly excited to be here because of my role at Kaiser Permanente for the last 5 years, where I had the opportunity to work with the Kaiser Permanente leaders in the Northwest, with Dan Fields, who runs our community health program, and Mary Giswold, who I know is very involved with the Virginia Garcia Health Center. But I'm also particularly excited for the work that I've done last year in working with Oregon, with my role as the vaccinations coordinator in the Biden-Harris White House. So I had a chance to work very closely with Governor Brown, who was a wonderful supporter of a lot of the vaccination effort, and some of the most amazing people in Oregon. I know Tina Edlund is on this call. I saw her name on the chat. Tina and I had a chance to meet, I think weekly, Tina, every Friday from 3 to 4, where we sit down and talk about what else can we do to support the outstanding work that was happening in Oregon. I know Tina retired retired and we got a chance to work with Tony Lopez, but throughout this past year, we got a chance to work with some outstanding people, including the Primary Care Association Executive Director, Joan Watson Patko, who also participated in many of the conversations that we've had. So we have a lot to be, I personally have a lot to be grateful for the leadership that the wonderful people of Oregon have done to get us where we are on the vaccination front. And I'm going to start, this next slide is just start with a story of one person I met last year who was tremendously helpful from my perspective in shaping the story around vaccination. You're seeing on the screen Felicia Thibodeau. Felicia is the executive director of the Southwest Community Corporation in San Francisco. And she's truly an everyday hero. She did this. She made sure that she stepped up and tried to do everything we can to get people vaccinated in her community. And she made sure that 1,270 people got vaccinated in her community. And she did this because she cared so deeply about the lives and the health of the people in her community. She went out there to meet people in person. She talked to them by phone. She answered their questions. She addressed many of the myths that people were having head on about the vaccine. She drove a van with 15 seats in it to take people to get them vaccination. She stopped at nothing. And people like Felicia made me realize how united we are as a country when it comes to fighting this pandemic. And also how important it is for community-based organizations, including and particularly for community health centers, to make sure that we did everything we can to get people vaccinated, addressing their questions, and for us to be able to put this pandemic behind us. So let's take a moment to remember how we got to a place where the Felicias and the Virginia Garcias of the world have done an outstanding job to get so many people vaccinated. In the next slide, I'm just going to talk about kind of where we were and where we are today. So if you think about this, I had the opportunity to work on this pandemic up close and personal for the last 2 years, the first year as the Chief Health Officer at Kaiser Permanente and last year as the vaccinations coordinator. And it feels like we're in a very different world today, but I just want to it's really important to remember where we were on January 21st, 2021. At the time, we had 2 vaccines approved in record time, thanks to the outstanding work that Operation Warp Speed had done. And we were ready to take on the massive job of vaccinating the country while also keeping an eye on global needs. And we had very few people vaccinated. There were no booster at the horizon. And this was only the beginning. And we had a huge task ahead of us as a country and around the world. So in the next slide, you see where we are today. So as we entered this pandemic, this 3rd year of the pandemic, a lot has happened. And now we have 3 approved vaccines in the United States and many more across the world. We have more than 218 million. Actually, this morning, we got to the 219 million people in this country fully vaccinated. That's nearly 2/3 of the people in this country. We have 99 million people who have been boosted, and we've administered more than 567 million doses of the vaccine. I actually administered 567 million doses of the vaccine. And we have more treatment options coming up to the market at a remarkable speed regularly, which is very, very encouraging. The next slide talks about something that was very important for us as an administration as we thought about vaccine. And if you think about when the vaccine became available, and Tina will tell you, Gil will tell you, every one of our colleagues at Kaiser Permanente will tell you, and probably everyone in this on the symposium will be able to tell you, a lot of people wanted this vaccine to be administered as fast as possible. And that was very important for us. Speed was really important. But we also wanted to make sure that equity is at the center of everything we have done. because we wanted to make sure that it's not just about speed, but also about equity of distribution and administration of the vaccine. And when you look at the very early months of the administration of the vaccination campaign, we were seeing widening of disparities between Black, Latinos, and white when it comes to vaccination rates. And because of a lot of the efforts that this country put together, the engagement of community health centers, community-based organizations, the faith-based community, trusted messengers in our community, we started to see closure of those gaps in vaccination rates across the country. And we got to a point where the vaccination rates in the Latino community is actually higher than what it was in the white community. But I do want to point out, as we see in the next slide, while we've made some really good progress on vaccination equity for the first round, for the primary series, what you'll see in the next slide is that we haven't seen that on booster vaccination rates. So while we still have a long way to go on boosters to get us where we need to get to, when you look at booster uptake by racial and ethnic group, we still have a disparity there that we have to continue to be focusing on. So we have a lot of work there to do. The other thing I want to point out in the next slide is the equity task force, the health equity task force that the administration put together, and it brought some outstanding people who are focusing on equity. And the president charged this group to come up with the set of recommendations that we need to take as a country to address health equity, and what are the recommendations that we need to prioritize to make that happen. And if you've gotten a chance to review this report, my really good friend, Dr. Marcela Nunez-Smith, chaired that task force, and some amazing people, including Bobby Watts, who's the executive director of the National Healthcare for the Homeless Council, was an active member of this task force. And that task force came up with more than 300 recommendations, including prioritizing about 55 of these actions. But if you think about where those priority actions landed, they really landed in 5 big buckets. One, investing in community-led solution to address health equity, which I'm going to come back to that because this is truly important. This community-led solutions is where it all needs to start. There's a set of priorities around enforcing a data ecosystem that promotes equity-driven decision-making, increasing accountability for health equity outcomes, which is something I know the healthcare system is focused on. I know we are focused on at KP, and I know community health centers are focusing on this as well. There's a big area of focusing on investing in a healthcare workforce that is representative of the community that those healthcare systems are serving. And then there's also the importance of making sure that there is a system in place that drives equity, that is have a direct engagement of the White House on. So I wanted to point that out because I think over the last year, that focus on equity that we've seen in everything we have done in the response to the pandemic is an opportunity that we need to double down on, and we need to make sure that we're taking those recommendations, those priorities, we're embedding them in the way we think about health equity as a country. And I know Virginia Garcia, Kaiser Permanente, the Primary Care Association, other groups, we all have a role to play, and we want to make sure that we continue to prioritize that. I'm going to move to the next slide just very briefly to talk about the importance of community partnership here. And I know I started with that, and that was one of the #1 priorities that actually did come out of the task force, but making sure that the community's voice is there, making sure that there is co-design of solutions for to address inequities in our community was going to be really, really important. And look, what we've seen again and again from polling, from focus groups, and I had the opportunity to listen in to a lot of focus groups last year, people trust people they know. And so it was really important that we do everything we can to lift up the role of the community voice throughout this process on vaccination, but this applies to all of our efforts around health equity in Oregon and across the country. So that's why it was so important that we bring up that trusted messenger voice. And early on in the vaccination effort, we were able to bring this COVID-19 trusted messenger group that included about 15,000 or so people, organizations from across the country that were engaged with the vaccination effort, were having access to a lot of the frequently asked questions, a lot of the efforts to respond to some of the misinformation, disinformation that was out there. And that group was really important in making sure that people in our communities, when they had questions, they could talk to people that they trust and people that they believe in. And that was an important part of how we think about addressing equity around the vaccination effort, but also overall. The next slide is really where I'd want to spend a few minutes, because probably one of the programs that I'm most excited about that we started early on in this effort was making sure when we thought about access to the vaccine, that community health centers across the country get prioritized with access to the vaccine. And we make sure that they have access to the vaccine through their state, but also directly through the federal government. And I think for this audience here, you're very familiar with federally qualified health centers, but if you take a step back and look, how many of those do we have across the country? We have about 1,470 community health centers across the country. They are serving about 30 million people in this country. More than 90% of people served by FQHCs are below the 200% of the federal poverty limits, and 62% are racial and ethnic minorities. So we knew early on that making sure that there is access of the vaccines at these community health centers was going to be key for us to make sure that we continue to keep equity at the center of the work here. And we've seen this at Virginia Garcia. It was great to hear Gail reference the 75,000 vaccinations that you guys administered. Nearly 2/3 of those went to people of color. We've seen that also across many other community health centers across the country, where we've administered nearly 20 million doses of the vaccine ended up being administered through community health centers, and nearly 2/3 went to people of color. So as we make sure that we're doing everything we can to close vaccination inequities, community health centers played a key role in that. And what I loved about the work that FQHCs have done, and I got a chance to visit with many FQHCs during my tenure last year, was not just bringing people into their clinic to offer vaccinations at their clinics. Many have done that, which was fantastic and really, really needed. But community health centers across the country did mobile clinic, went out to soup kitchens, set up tents in areas that are harder to engage. So went up to soup kitchens. They went to under the bridges with our Healthcare for the Homeless program. So just truly outstanding work of vaccinations. And in many instances, it wasn't just for their patients, but it was also for their communities and making sure that they leveraged their trusted role in the community to be able to get a lot more people vaccinated. One other thing I think that became very clear throughout this response to the pandemic was that people had a lot of social health challenges throughout this pandemic. And we'll go to the next slide. Just want to highlight how important it is. And one of the key lessons I think that we learned from this pandemic is that we really have to pay attention to people's social health the same way we pay attention to people's physical health and to people's mental health. If you think about individuals, and I had the honor and the privilege to practice in a community health centers and in a Healthcare for the Homeless programs. And for many of my patients, it wasn't necessarily just about controlling their diabetes or managing their high blood pressure. I've had many conversations with my patients about where they're going to sleep that night, where they're going to get their next meal from, whether they're going to have enough money to be able to pay their rent, or they might end up on the street next month. Those were the issues that many of my patients brought up regularly with me. So as we think about the role of health systems, and as we recover from this pandemic that exacerbated the inequities that we've seen in our country and put it in really this stark focus, we have to be thinking about how we lift up the importance of paying attention to our members and our patients' housing, food, transportation, access to money to be able to meet their basic needs, the same way we think about their diabetes and hypertension and depression. And that's why we've been, as an organization, and we've been partnering with community health centers across the country, lifting up that importance of focusing on physical health, mental health, and social health in a way for us to be able to optimize the health and well-being of people that we serve. So in the next slide, you'll see about why this work is so important, why we need to be thinking about that. I know community health centers, since their inception, that's been an integral part to the way we deliver care at community health centers. And now we're seeing other health systems, including the health system I work for at Kaiser Permanente, where we're investing tons of resources and time and energy and community partnerships to make that happen. So if you go to the next slide, when we think about our role as an organization with about 12.6 million members across the country, it is really important that we pay attention to our members' social needs. We ask for our members' social needs, we screen for those social needs, and we build those networks of community-based organizations for us to be able to support those members with those social needs and make sure that we are responding to those needs. And we're also there to support the community-based organizations when they are dealing with patients who might need some health services. So we have that two-way interaction. So we're making a commitment this year to screen 2 million of our members across the country. We're really excited about that. And we're going to continue to do everything we can to deliver on that for our members. I do want to point out that this work around the social health, truly Kaiser Permanente Northwest has been a leader within our system in making sure that we are doing this work. They are aiming to screen 1 in 4 of their members for social needs. That's about 150,000 members will be screened and connected to community resources as necessary. And I have to say that this type of screening would be really dependent on the ability to have a robust system in place to be able to connect people to that community network. And I know in Oregon and Southwest Washington, we have over 565 community partners active on that social health platform. And together they offer more than 700 different programs. So we're really excited about that platform. And I'm really excited that soon the Northwest region of Kaiser Permanente will become the first to use our social health platform to not only send referral to community partners, but also be able to accept referrals from those partners back in the system. And this will be the first for Kaiser Permanente, that back and forth engagement. And I'm really excited about that. And finally, I do want to give a big shout out to Virginia Garcia leaders and staff who were one of the very early adopters of the social health platform. Thanks to them and many other, the Northwest region has built a successful, well, the Northwest has built a successful statewide social health referral platform, the Connect Oregon, that is now active in nearly all of the 36 of Oregon counties. So a lot of stuff to be proud about. So I look forward to talking more about this in a moment. But in the next slide, this is where I'd want to end here by saying that the past 2 years have brought us a lot of collaboration between the public health system, the community health system, and the healthcare system. And we have to be able to strengthen those collaborations, build on those collaboration. We had to be able to build trust the crises that have been fueled by the pandemic have demonstrated once again how crucial it is that we build trust, especially when there is a need for a collective response. This is truly, truly important, and we have to be able to commit to engaging. We have to be able to commit to transparency, but also we have to be able to engage and listen and co-design with the community when it comes to building those trusts. So I'm incredibly proud and excited to be with you here today. I want to make sure that we have plenty of time for questions and answers. So I'm going to stop here and we'll open it up for questions. Oh, Carol, I think you're still on mute.
There I am.
All right.
I wasn't even on camera, much less on mute. Boy, this is 2 years later, and I think I'm still trying to learn how to use this thing. Well, thank you, Bashara, very much for such a wonderful and very informative presentation about all the work that you've been doing in the at the national level. And of course, obviously, we're very excited about all the things that have been happening here at the local level as well. I just want to remind folks that you can enter your questions in the chat. One of the things that we're going to be doing is monitoring the chat and trying to organize questions so that we can make sure to get as many of them answered as possible. And so I think I'll just go ahead. I have a whole bunch too if we run out. So, what I'm going to do is just go ahead and jump right in. And here's one that's kind of interesting and sort of starting at the very high level. Would you highlight several of your key learnings from your time in Washington?
Sure, happy to do that. And I have to tell you, Carol, that's not a job that you would ever be prepared for. So I went there not knowing what's going to happen. There was tons and tons of learning, but I'll probably highlight three that are really significant from my perspective. One, I think we have seen this past year that we were just simply unprepared as a country when the pandemic hits. We had a public health system that's under-resourced. We had a healthcare system that was stretched way too thin. We had an education system that was really, really struggling. And all of this ended up with us having a significant toll on the economy. So I think as we move forward, it's really important that we do a much, much better job to be prepared on the public health system and the healthcare system also. The second piece I think that I've learned throughout this past year was the importance on focusing on equity from day one. And I know in my remarks I brought that up, but if there's one silver lining here is we'd want to make sure that we take the learnings of how this pandemic had exacerbated the inequities in our country and make sure that we incorporate a focus on equity on everything we do to be able to really make a difference. The third learning, unfortunately, is all the politicization and the misinformation and disinformation that we've seen. And it's unfortunately real. And I think we anticipated we're going to deal with misinformation. I think one of the learnings that we've seen is the scope, is the sophistication, it's the scale of misinformation that we've seen. And a lot of that is related to the politicization of key public health challenges that we were trying to respond to. So I'm hoping that that's a learning that we learned from and adapt so that we're not in the same position in the future.
Boy, that's something I've been thinking about quite a bit in terms of the politicization of terms like equity, racial justice, critical race theory. Don't know if we want to go down that road in this session, but definitely I see that as a potential big barrier as we try to move forward with advancing equity for all.
Yeah, I mean, I have to tell you, I had the opportunity to go and visit with a dozen states in person, and many of these states I haven't visited before. And I got a chance to spend time in every one of these states. I got a chance to spend time with community health center leaders, primary care docs, leadership, family physician, pediatrician, hospital leaders. And I've heard so many stories about these physicians who are going to testify at school board meetings about the importance of masking in the midst of a Delta surge, and these folks getting booed, these folks getting threats to their home about just lifting up what's the absolutely right public health thing to do. And unfortunately, this didn't just happen in it happened across the country, in some states more than others. But the reality is the politicization is just something that we have to figure out how to never get into that spot ever again.
Yeah, thank you for that. Here's another question. As we think about these partnerships and learnings over the past 2 years, what do you see as a top priority for all of us, community health centers, public health, and healthcare systems, to continue to move the work forward? This is 2 questions in one. So how do we continue to strengthen these relationships and collaborations to remove barriers for all those we serve?
Yeah, and I have to tell you, I mean, I think one of the things that I'm most proud of over the last year was making sure that we put resources in the American Rescue Plan that went directly to community-based organizations. We've significantly added funding to community health centers for that main purpose of building those bridges between the healthcare system, the public health system, and the community health system. And it will be truly disappointing if we lose momentum on this. This means we're going to require additional resources to continue to systematize those bridges that were built. And that's an integral part of the future of how we think about public health. I know there's a lot of discussions at a national level right now as to how we reimagine public health for this country. And a key component of that reimagination is going to have to include a systematization of the way we connect those 3 systems together. We can't function in silos anymore. And I have to tell you, across the country, we've seen a continuum of where those relationships are. And honestly, we've seen a continuum of where the relationships are between federally qualified health centers and local health departments. And that's why when we put the vaccine availability, we had to have a 2 system. Like FQHCs could get their vaccine through their state and local health departments. But because that relationship was so variable across the country, we needed to make sure there was a federal program that's directly supporting FQHCs with vaccinations. That is not okay in the future. Like, we need to make sure that community health centers and leaders and their local health departments and their local health officers, they know each other, they work together regularly, they have systems in place to support those partnerships. Those are really, really important to keep down the line. And that requires resources, as we all know.
Boy, that's so true. And, I'm so happy that you brought up the systematization. That's a hard one to get out.
I know.
Of partnerships. I actually wrote that down as a question for myself. And one of those things that came up for me in thinking about those, how much focus you put on our community partners is the lack of resources, in fact, on the part of community-based organizations, CBOs, when it comes to being able to have the resource and the capacity to be able to partner with healthcare systems and locals and, all the groups that the question brought up. Do you see any movement towards funding, accessing? I mean, part of the challenge, I think, is accessing public resources on the capacity to access resources through a process that can be very bureaucratic and challenging. Thoughts about that? Any way to fix that? Any movement?
Yeah, this is such an important issue, Carol. And one of the things that I've done last year, I had weekly calls with community-based organizations from across the country. There's a coalition called Made to Save that I used to meet with every week during my tenure at the White House. And what I've learned throughout this process is something I kind of sort of always knew. Like, you can put resources, but you have to make sure that the way these resources are made available are equitable to community-based organizations across the country. And it's sometimes a lot easier for CBOs that have built the infrastructure to be able to write grants, submit reports, submit financials so easily. It's easier for that group of CBOs. And in many instances, it's the much smaller CBOs that are going to be very effective at the uber local level. So how do we make sure that throughout the systems of making resources available, we're not making it harder for those very small community-based organizations that are truly grassroots. You're not asking them to submit a 50-page grant proposal with budgets and electronic systems that you need to be engaged in, and that makes it really hard for those community-based organizations to do this work. And that's why I'm incredibly proud of our team at Kaiser Permanente, particularly our team in Kaiser Permanente Northwest, that have kind of kept this as a key focus and making sure that when we create support for these CBOs, we have to make sure that we're supporting all levels of CBOs, particularly the really small ones that don't have the infrastructure to be able to be competitive and, multi-billion-dollar announcement from the CDC.
Oh, thank you so much for that. Let's see, let's talk a little bit about, disparities. So we had a couple of questions. In discussing disparities, are we seeing a disparity in distribution of antivirals, and do they vary by geographic region of the country?
Yeah, I have to tell you, this is a space that we really have to pay close attention to. I actually, right before joining this call, I was spending some time just understanding the availability of antivirals for our own Kaiser Permanente locations. How are we distributing this? Are we making sure that we're making access to Paxlovid or the monoclonal antibodies equitable across our system? And this is something that we have to look at a national level. I remember when monoclonals became a thing back in maybe the summer of last year. I spent a lot of time with community health centers, and I encouraged them state after state after state. I've had lots of calls with primary care associations. We've worked with NAC to make sure that NAC and the state health associations are creating opportunities for community health centers to learn how to be partners on the monoclonal. And mind you, monoclonal was a lot harder. A lot of it was going to be IV infusion. Then it became the sub-Q, which was easier, but still it wasn't, as easy. But now that we have Paxlovid, it's really important that for those oral therapies, that we are paying a close attention on geographic distribution, making sure that they're getting to people equitably across the country. Because again, we know that this virus is hitting Black and Brown communities much harder than the rest of this country.
Thank you. I see a question here about boosters. That's something that we're looking at now here with the second booster being approved for those 50 and older. Where did it go? Oh, here it is. What do you see as the top strategy in increasing and maintaining boosters for underserved communities?
Yeah, so two things to think about when it comes to boosters. One, we still have a long way to go as a country. There's just no doubt about that. I think we're at about 50% of those who qualify who are eligible for boosters have gotten their boosters. What concerns me the most there's inequity on who's getting boosters and who's not getting boosters. So I think for that very first booster, which I know we call it booster, but the data are so clear that this is really, really important to prevent hospitalizations and deaths. So I think we really want to make sure that for community health centers across the country, health systems, local health department, we want to do everything we can to make sure that people who are eligible for their first booster who haven't gotten it yet are getting their booster. So that's really important. At Kaiser Permanente, I'm really proud of how our membership have responded, and we have much higher rates of booster folks getting their booster shot compared to the national averages, but we want to make sure that this is happening throughout our partners, with our partners across the system. So that's one. Now, the second piece that's also important is the second booster. And I know the CDC put eligibility for 50 plus for people who are now eligible for the second boosters. We're starting to see increases in number of cases, particularly related to the BA.2 variant. The good news is we haven't seen increase in hospitalization. So I think for those, particularly those who are very vulnerable, 65 and older, lots of chronic medical conditions, people really need to consider getting their second booster. And look, we're also at the same time watching what's coming out from Moderna and Pfizer about a potential different version of the vaccine for down the line. So we have to keep a close eye on that as well. The one thing I would say, get vaccinated if you haven't been vaccinated yet, get boosted if you haven't been boosted yet. If you're one of the very high risk groups that could benefit from a second booster, please do that. But equally as important, I think a lot of the people in this country are not aware that we do have treatment options. And if you test positive, and a lot of people now are doing their tests at home. So if you test positive, you do, and you have the high risk factors, you could qualify for an antiviral. It's really important that that message gets to your patients. Really important that we do that. A lot of people don't know that we do have oral therapies available to help prevent people from ending up in the hospital.
Yeah. Well, boy, we could go on and on for quite some time, but unfortunately, I've gotten a notice that this was the last question that I could take. I want to thank you so much. And actually, my final last question was based on an email I got from a former colleague at OHA who knows you quite well, and said that you walk on water and that you're the best partner a state official could ever hope for. So my question is, how do we get more of you?
Oh, that is so humbling, and it's so wonderful to hear. Thank you, and it's truly been an honor to have the opportunity to work with the outstanding people at Kaiser Permanente. And this past year, it's been truly humbling to be able to serve in that role, and it was an all hands on deck, and to see the country rolling up its sleeve and doing everything we can to make a difference. You know, I talk about Felicia Thibodeau, I talked about her in my slide, but the reality is there's tens of thousands of Felicias across the country who did outstanding job. And I had the honor to be able to talk to a lot of people, learn from a lot of people, and the country is so grateful and thankful for these folks who are the true heroes who get these shots into people's arms and helped us make really good progress in putting this pandemic behind us. Still have a lot of work to do.
Yeah, well, it's certainly been an honor for me to moderate this session with you, to get to meet you. Thank you so much on behalf of myself, but also, of course, on behalf of our participants and Virginia Garcia. We're very, very grateful to have you here and for you to be doing the work too. So thank you so much.
Thanks, Carol.
Okay, so I'm going to let folks know that this past hour recording will be available on the Virginia Garcia's website. It will also be available on their YouTube channel and social media channel in the next few days. So once again, thank you everyone for participating, and we'll look forward to seeing you again soon, next year, in fact, maybe in person.
Thank you, Carol, so much for being here with us today. Good afternoon, everyone. My name is Stephanie Caballero, and I'm the Executive Director for the Virginia Garcia Memorial Foundation. It has been my pleasure to see all of you here today. Born from adversity, Virginia Garcia was founded on the belief that everyone, regardless of immigration status and origin, deserves the equal healthcare and the high quality, appropriate healthcare they deserve. We heard a little bit about that during Dr. Shakir's presentation, and highlighting a lot of his learnings. And we see Virginia Garcia and the work that many of you in the community are doing to support our diverse populations, our underserved populations. And we really thank you for joining us today. The past 46 years, Virginia Garcia has been ensuring that our patients can have access to just that, the high quality care they deserve. And we acknowledge that in partnership with many of you across our communities, they can continue to trust us in bringing the healthcare that they need right now. As we think about the future, and as we think about the work that we need to continue to do to provide COVID-19 services to the diverse population and meeting their needs, today I want to invite you to help us support the work that Virginia Garcia and our staff are doing to continue to bring the services to our patients, but also others in our community. We have expanded to be able to serve many diverse populations who are also facing the same barriers our own patients continue to face. And your support today is going to allow us to continue to ensure that all of these individuals and patients continue to have access to the vaccine, testing, therapeutics, and education, and that they can receive all of these services in a way that meets their needs and is culturally appropriate. You can scan the QR code that you see now on your screen. And also you can use, for those of you who aren't familiar, you can use your camera phone and scan it, and it will take you to the donation page. We hope you will consider giving to support Virginia Garcia's services now. And we thank you for your consideration and for standing with us as we continue to navigate the uncertainty of what this next step in the pandemic brings for all of us. I would like to take a few moments to thank each of you for joining us. Thank you. But I also want to take a special moment to thank Carol. Thank you so much, Carol Cheney, for joining us today, guiding us through this conversation. When we reached out to you, you said, yes, count me in. And we are so grateful for all the ways in which you support our communities. Thank you. To Dr. Bashar Shakir, thank you for taking the time out of your busy schedule to join all of us today, share some of your insights, learnings, and fantastic experience throughout your career. We can't thank you enough. And I'm sure we'll have a lot more questions coming, and we'll work with you and your team to hopefully help us answer these for the folks who joined us today. But truly grateful for all of your support today, for joining us. And I also want to give a special thank you to the Kaiser Permanente team for making today's event possible and working with us along the planning stages and making sure that we continue to engage Dr. Shakir in the planning and ensuring that we were able to meet the questions that all of you would have. Thank you for your continued support. I also want to take a moment to thank our event sponsors. Without them, today would not be possible. So I want to take a minute to do that. And so I would like to start with our annual partners, A to C Wineworks, Care Oregon, and I think we jumped, thank you. Care Oregon, Kaiser Permanente, Legacy Health, Linguava Interpreters, McDonald's Zaring Insurance, Oregon Health and Science University, OHSU, and One Digital. Thank you for your continued support of our work. I also want to thank our friend level sponsors for this event, Northwest Health Foundation and Passport to Languages, Inc. And to our ally sponsors, thank you as well for joining us in making this event possible for all of those who are here. And last but not least, I just wanted to say that as we look ahead to the future, we look forward to the opportunity to continue partnering with each and every single one of you to bring healthcare to all of those that we serve. We will continue to deliver and meet the need of our communities with you by our side, and we can't thank you enough for your continued partnership. Thank you all for joining us. Be well.